Hello, this is Whitney Richardson, and today we are going to be discussing the musculoskeletal system. All right, when you think about the musculoskeletal system, it's very important for you to think about movement. How are you able to bend your fingers? How are you able to pick something up? How are you able to ambulate? So that all has to do, all of movement of your body has to do with the musculoskeletal system. So, anatomy and physiology of the musculoskeletal system. So, the skeleton basically is the supporting structure that provides shape, that provides protection. If you think about us, we're as humans, we're made of lots of water. We're composed of a lot of water, right? So, without the musculoskeletal system, we would just be like a big blob. And so, the skeletal system provides support. The fact that you're able to stand up and walk upright is because of the skeletal system. Okay, there are different types of bones. Well, the skeletal system consists of bones. So you have different types of bone. You have flat bones, you have long bones, you have short bones, you have irregular bones, and you have sesamoid bones. All of those things are important because if you think about your finger bone, it does something different than your leg bone, or the bones in your neck do something different than the bones in your jaw. And that's why they're all different types and different shapes because they serve different purposes. There are also different types of joints. When I think about me opening my arm up and closing it, so there's different. There are all different types. You have your pivot neck vertebrae, right? You have your hinge, as we were speaking about the arm opening and closing. You have your saddle and plane. You have your condyloid. You have your ball and socket. Think about your hip, where it just kind of fits into each other. And then when you think about, aside from the bones, the muscles work together with the bones, right? So your muscles, they allow the movement of the body. They help to maintain your posture, and it helps also with the circulation of blood. If you or a person ever fractures their bones, basically right at the start, inflammation occurs. So inflammation starts immediately after the bone is fractured, and it lasts for about several days. So when the bone is fractured, there's usually bleeding to that area, leading to inflammation and clotting right at the fracture site, right where the bone, where the fracture has taken place. This provides the initial structural stability and framework for producing new bone. Remember, the body is always going to try to bring the body back to homeostasis. It's always going to try to repair itself. Okay, with bone production, it begins when the clotted blood formed by inflammation is replaced with fibrous tissue and cartilage. This is known as soft callus. Okay. So as healing progresses, the callus is replaced with hard bone, which is known as a hard callus. So you have the soft callus and you have the hard callus. So the soft comes first, and as the bone becomes replaced rather with the hard bone. Okay, and after this takes place, a person can do an X-ray. The doctor can order an X-ray on a person, and you're going to be able to see that within several weeks after the fracture. Bone remodeling. This is the final phase of bone healing. So it goes for several months. And in remodeling, the bone continues to form and becomes compact, returning to its original shape. In addition, blood circulation in the area improves. Once there is adequate bone healing, after that, you can weight bear. The patient can actually stand up on that leg. Let's say it was the leg that was fractured. After the bone has been remodeled and strengthened, now that patient can actually weight bear and walk on that fractured leg. Okay, because it returns right back to its original shape. There are numerous risk factors that are associated with musculoskeletal disorders. When you think about calcium deficiency, you can think about degenerative conditions, trauma or injury, infections, medications. Some medications that you take, that a patient takes, can cause their bone to become brittle. Obesity. That person might be prone to, more fractures because of the heavy weight that the bones have to carry. And then postmenopausal states where a woman's bones becomes brittle after menopause. So there are different risk factors that you can think about. In terms of the musculoskeletal system, there are many diagnostic tests that can be used to be able to let us know if there's something going on. The most common that you most likely know of would be the X-ray. You guys know that the X-ray is basically a picture of what's going on beyond the flesh, beyond what the naked eye can see. So that's called radiography. There's also arthrocentesis. It is the clinical procedure of using a syringe to collect synovial fluid from a joint capsule. It's also known as joint aspiration. So basically, the technician would inject a contrast dye or air with a long, thin needle. And usually the doctor uses fluoroscopy or an ultrasound to basically guide the needle to the area around the joint. Sometimes the doctor may ask you to move the joint around so that the dye can spread so that he can have a better visual of what's going on. So basically, an image is taken of the joint in different positions with either X-ray, fluoroscopy, an MRI, or a CAT scan. Okay? You as the nurse, your duty is to make sure that you ask the patient to make sure that they're resting 8 to 24 hours before the procedure. You also want to instruct them, your patient, to notify the doctor if they feel any fever or if there's any swelling of the joint. If any of that develops, you want to let them know to inform the doctor as soon as possible. Another diagnostic that is used is arthrography. It is a type of imaging test used to look at a joint, such as the shoulder or the knee or the hip, and it may be done if standard X-rays do not show the needed details of the joint structure and function. So basically, the X-ray would be first, and if after looking at the X-ray, the doctor doesn't see exactly what they're looking for and they want to dig a little deeper, then they may order for arthrography instead so that they can have a deeper look of what's going on. With that, you want to make sure that you're asking your patient if they have any allergies. Do they have any allergies to iodine? Do they have any allergies to shellfish? Instruct them and let them know that the joint may be edematous. They might see some edema around the joint, and it might be tender 1 to 2 days after the procedure is performed. So it's important for them to know that in advance so that they're not in shock when they do see that they're having some edema around the joint that was assessed. Okay, and then it goes back to your normal nursing. Normal nursing activity. What would you do? You would ice it. You'd give them an ice pack, give them analgesics for pain, and basically just to make sure that they're comfortable, okay? Some other diagnostic tests include bone mineral density measurements, bone scan, bone or muscle biopsy, electromyography. With your myelography, you want to, just like the other test that we spoke of, you want to assess for allergies, because many of these tests uses iodine. So you want to ask them, are they allergic to iodine? Are they allergic to shellfish? Because some of these procedures use dyes. Okay? After the procedure, you want to make sure that you're elevating the head of the bed 15 to 30 degrees for about 8 hours as prescribed. And if an air contrast was used, keep the head lower than the trunk as prescribed. So if a water-based or oil-based contrast agent is used, the head would be elevated. If air or contrast is used, you would keep the head lower than the trunk. Okay, so just making sure that you're following those procedures as you should. There are different types of injuries that can happen. There are strains, and there's like rotator cuff injuries. And there are different types of fractures that can occur. Basically, there's a transverse fracture. Basically, the bone just it's almost like someone cut it in half this way. You have oblique. Basically, the fracture occurred at a slant. You have spiral. You have comminuted, where there are lots of different pieces of the bone that is fractured. You have avulsion, where a distal portion of the bone may be fractured. Impacted, where maybe the bone got squeezed together, basically. You have a fissure, and then you have a green stick fracture. All of these point to a different type of how they got the particular fracture. When you look at them, like, some of these things can be due to physical abuse. Some may be due because of an accident. Some may be because of a sport. So basically, make sure the story that the person's giving you, make sure the stories align. All right, so what a fracture is. A fracture is a break in the continuity of the bone caused by trauma, maybe twisting as a result of a muscle spasm or indirect loss of leverage or bone decalcification and disease. So basically, we spoke about all these different fractures, just letting you know there are different ways that you can, that the bone can become fractured. Okay? And we spoke about the different types. One thing that you are definitely going to make sure that you're assessing for, or a few things that you're going to be assessing for, is pain. Clearly, this person just broke a bone. They just fractured a bone. So definitely this person is most likely going to be in pain. The person is going to feel tenderness. Maybe when you touch the area, they're going to, brace themselves or say ouch because the area is tender. And then there's also things that you need to be assessing for visually is basically obvious deformity. If you see that, if you know that the bone, is supposed to go in this direction and then all of a sudden it's twisted in another way, and lets you know, hey, something's going on. This bone must have gotten fractured. Okay, the initial care that you as the nurse is going to provide is you're going to make sure that you immobilize that area. If a person, let's say, broke their wrist, you're not going to allow them to move it all about. You want to make sure that it's staying in one area, and make sure that it's anatomically correct. Okay, you're immobilizing it. If there's a wound with the fracture, because sometimes there's a fracture but there's no open visible wound, but sometimes there's a fracture and there's actually a wound, maybe the bone is sticking out, etc. You want to make sure that if the bone is open, that you want to cover that wound. Okay, assess for neurovascular status, making sure that they're able to feel around whatever you're touching to make sure they're feeling that. You want to, reduction restores the bone to the proper alignment. Sometimes they get to the emergency room and the bone is kind of displaced, and the doctor would basically reduce it, bring it back basically to in alignment to where it's supposed to be. Painful again, something else that's painful. Fixation, it provides the proper bone alignment and it reduces muscle spasms. And many times with fractures, the doctor will order for the patient to get a cast. Maybe they can get a plaster cast or a fiberglass cast, and that is basically used to immobilize the bones and joints, so that it can correctly align the bone back to where it needs to be after the fracture or after the injury. One thing that we remembered was the acronym RICE. You would rest, you would ice, you would compress, and you would elevate. That's one thing that we learned in terms of treating fractures. All right, so there's something called, there are some complications, obviously, with everything but there are some things called the 5 Ps that you would, as a nurse, that you would be assessing. You'd be assessing for pain. You'd be assessing for pallor. You'd be assessing for paresthesia. You'll be assessing for pulselessness and paralysis. All of those things are very important for you to make sure that the patient are they in pain? Okay. How is the color? How does their skin look? How does the color look? Is it very pale? Is it very red? Paresthesia, can they feel it? Can they feel you touching them? Pulselessness, you're checking to see if circulation is reaching to wherever it is, and you're checking for a pulse. And paralysis, are they able to move it? Okay. Other complications would be fat embolism, avascular necrosis, or pulmonary embolism.